Hello everyone, welcome back to my channel, that is Obstetrics and Gynaecology Simplified. Today we are coming with a very interesting topic, that is obstetrics instrument. These are frequently asked in the Viva, and children often ask about the how to identify the instruments as well as how to see or how to use the instrument, how to examine the patient using the instrument, and what are the parts and what are the uses of the obstetric instruments. So I will make it a part-wise video. Today we will do the part 1. So let's start. Coming to the first instrument, that this is very commonly used in obstetrics practice. This is called as SIMS double-bladed non-self-retaining posterior vaginal wall speculum. Okay. So it is a double-bladed, means it has two blades, 1 and 2. These are of unequal breadth. Why? Because see, this is a little wider and this is a narrower blade. Okay, so these are used, the narrow one is used for the nulliparous woman and the wider one is used for the multiparous woman. Okay, so these are the two blades, and the SIMS double bladed posterior vaginal wall speculum, these are of unequal breadth and used to facilitate the introduction into the vagina depending upon the space available, narrow for the nulliparous and wider for the parous woman. And what are the uses? It is used, see, first I will tell you how to introduce the speculum. How to introduce? First we will hold it like this and we will introduce, like this is the vagina, we will introduce in a longitudinal pattern and then we will slightly rotate and then we will retract the posterior vaginal wall so that the inside structure is visible. Okay. Then what is the use? To inspect the cervix and the vagina and to detect any injury following the delivery, and also it is used to clean the vagina following the delivery, and to inspect the cervix and vagina to see the causes of FPH. What is FPH? That is antepartum hemorrhage. Okay, but the Cusco speculum, it is preferred. In the next part I will be showing you about the Cusco speculum and other uses like DNC operation we can use. Then coming to the second one, see this one, this is the single bladed speculum because here no blade is there, and another, this is the blade and this is the shaft to or handle to hold. And what is the groove present? What is the use of the groove? The groove, it is present so that any discharge or any cervical or vaginal discharge that is coming, it can be, when we retract, any pulling or any discharge, this can be drained through the groove. So the drainage of the discharge or any pulling fluid can be drained through this groove. This is the use of the groove, and how to introduce I have told you. Then coming to the next part. Next one is the Alice tissue forceps. Okay. So what are the parts? See, these are the finger rings. Okay. These are the finger rings. How to hold? See, the ring finger and the thumb. It is used to hold like this, and the index finger, it is used to guide the Alice tissue forceps. Okay. Then what are the uses? See, it has a serrated end so that it is used to hold the tough structure. Okay, so tough structures can be held by Alice tissue holding forceps. And what is the use? Use is to catch the anterior lip of the cervix using dilatation and curettage, as well as to hold the apex of the episiotomy wound during the repair, and also it is used in cesarean section. Okay, the margins of the peritoneum, rectus sheath and vaginal mucosa during the repair we can hold, and also during the complete perineal tear we can use, and also to achieve the hemostasis we can just do, and this is the lock, it is present, so we can lock it like this. Okay, this is the complete lock according to the strength. If complete lock means more strength or more tightly the tissue is held. So this is the use of the Alice tissue holding forceps. Then coming to the long straight scissor. See, this one is a long straight scissor. It has no lock. Okay, lock is not required, and also this is the finger rings and this is the blade. So what is the use? It is used to cut the umbilical cord, and also we can use this one to make the episiotomy wound. Okay, but for episiotomy the Mayo scissor or episiotomy scissors are used, and also we can cut the suture materials in this cesarean section. Okay, so this is the long straight scissor. Then coming to the uterine sound. See, this one is the uterine sound. here, what are the parts? See, we can see here, anteriorly it is curved slightly. Why? Because we know that uterus is anteverted and anteflexed. So as the uterus is anteflexed, when we introduce the uterine sound into the uterus, we can know if the uterine sound goes like this. So we can know that the uterus is anteflexed. We can know the position of the uterus. Okay. And if it does not go like this, if the uterus is anteverted or retroverted, then what we do? If this one is like, we introduce the uterine sound like this, then it goes like this, and we can know that the uterus is retroverted. If it goes like this, then it is anteverted, and if it turns and it goes like this, then it is retroverted. Okay. Then what are the parts? See, it has graduations present, so that we can measure the uterocervical length. And here we hold like this, and then we introduce in a pen holding pattern. We hold and then we introduce into the cervix and then to the uterus. So what are the uses? See, it is olive pointed, graduated and malleable. Malleable means we can just change the shape also. Okay, this is very flexible or malleable. And what is the use? And it is metallic uterine sound, and it is used to know the position of the uterus, length of the uterine cavity, and also before dilatation and curettage we can use this to dilate the cervix and to sound the uterine cavity to detect any foreign body. Okay, so when any foreign body is present and we introduce, it makes a metallic sound. Right? This is the foreign body, it is present inside the uterus, and we introduce it, and then a sound is produced. Okay, so this is used to detect any foreign body, and it acts as a first dilator of the cervical canal. So this is a uterine sound. Okay, it has anterior curve. Then coming to the next one, this is the Hegar's dilator. These are the serial Hegar's dilator. Okay, it is also called as Das dilator or Hawkins-Ambers dilator. Okay, then Hawkins-Ambler dilator, it has got 16 sizes. Okay, smallest is 3 and larger one is 21. Okay, and Hegar's dilator, it is double-ended. I will open this one. See, these are double end. One, see, this one is the midpoint. Okay, so this one is one part, this one is another part. See, this one is, you can just see that this part is slightly, see, number will be written here. So this one is 5. Okay, 5 and 6. Okay, 5 and 6. So this one is little, if gradually we increase the size, then the diameter is gradually increased. So it is written 5. So this one is 5 mm diameter and this one is 6 mm. So serial dilator means first we will introduce the 5 into the cervix and then it will be dilated, and then again serial dilatation we will introduce this one, that is 6. Okay, so this is the Hegar's serial dilators. Okay, this is the smallest one and more larger also present. Okay, then what is the use? It is used in dilatation of the cervix prior to the in DNC procedure. We use this to dilate the cervix. Okay, then the dilatation of degree of dilatation is required first in incomplete abortion. It is sufficient so that the index finger can be introduced, and in suction evacuation one size smaller than the size of the suction cannula is used for dilatation of the cervix so that suction can be done, and also in MTP we can use this for dilatation and then evacuation. Then coming to the next one, that is the sponge holding forceps. This is the sponge holding forceps. Okay, see this one also here we have 2 fingerings and this is a long shaft, and then here serrations are present. Okay, see serrations are present. So what is the use? See, this one is the long serrations. So we can also use this one to hold the tough structure, but we should not injure it. Okay, it has also a lock, So gradually if the lock is increased, then more power. See, this is a sponge holding forceps. So what are the parts? See, this one is the rings, finger rings. We use the ring finger and the thumb to hold the instrument, and then we use this support. Okay, this is the index finger and we hold it for the support, and then we lock it for any use. So let this one is the gauge piece. Okay, this is the gauge piece. We hold it like this. Okay, we hold it like this and lock it so that it is more tight. Okay, like this it is little flexible, but when we give it more lock, then it is grabbed more tightly. Okay, then we use the kidney tray or the small tray for the painting. Okay, we use the betadine, and then for the painting we use what painting we do. See, here the body or the umbilicus or the abdomen is painted. Okay, the pubic part is painted, the thighs are painted in cesarean section. Okay, then what are the use? So first is toileting of the vulva, vagina and perineum prior to the cesarean section, to catch hold the membranes during the delivery of the placenta, and to catch hold of the cervix for inspection in the cervical tear, and to catch hold the cervix during encephalic procedures. So this is the use of the sponge holding forceps. I am showing you again. This is the sponge holding forceps. Okay, and these are the uses. Then coming to the next one, that is the ovum forceps. So these are, see, this one, the sponge holding forceps and the ovum forceps, these are similar. Okay, but what is the difference? See, the difference is first difference, starting from here, it has no ratchet. Okay, no lock is there. Why? Because see, ovum forceps we use so that the written product of conception can be taken out without damaging or without breaking the gestational sac. Okay, so as the lock is not present here, so it is atraumatic. Okay, we just hold like this and then bring. No trauma will be produced because of the lock, so it is atraumatic. And also see, this one, it has fenestration, large fenestration, but this has only a single fenestration and it is small, slit like fenestration is present. And laterally you see this one is flat. Okay, this one is flat, but this one is curved. Okay, so this one is curved, the ovum forceps is curved because it can accommodate the retained product of conception. Okay, so these are the difference between the ovum forceps and the sponge holding forceps. So it has got no catch and the blades are slightly bent and fenestration. See, the blades are bent, okay, or curved, and a fenestration is present. So absence of the catch, it minimizes the catch. This one is catch. Okay, so the absence of the catch minimizes the uterine injury, and if accidentally caught, it prevents the crushing of the conceptus, so it can be brought intact. And it is to be introduced with blades closed. Okay, first we close the blade and then introduce into the uterine cavity and then grasp the product. Let this one is the product of conception. Okay, we introduce it. It is present in the cervix. So we introduce to the cervix into the uterine cavity. Then we grasp it. Okay, as there is no catch, so we cannot just more press, or no injury will be there to the conceptus, because we can, even if we try, we cannot just crush it. Okay, then it is to be introduced with the blades closed, then to open up inside. Okay, open up inside, then grasp it, and then with a slight rotatory movement we try to bring it down through the vagina. Okay, so this is the ovum forceps, and the rotatory movement, it does not only facilitate the detachment of the product from the uterine wall, but also it minimizes the injury of the uterine wall if accidentally grasped. Okay, uterine wall also we do not know inside what is happening, so if we grasp the uterine wall, if when we rotate, it will be slipped off the uterine wall and only the conceptus will be taken out. So this is the ovum forceps. Then coming to the next one, that is the uterine curette. See, this one is the uterine curette. This is a small one, this is the larger one. Okay, so uterine curette. See, this has a what are the parts? See, one end and another end. Okay, one end is sharp. See, this one is the sharp end and this one is the blunt end. Okay, and what are they used? It is used, and it has serrations so that we can hold it. We hold like this. Okay, so grip is good here. And then what we do? The common use is during the dilatation. What we do? Dilatation and evacuation or dilatation and curettage. First we put the uterine sound, then we put the Hegar's dilator to dilate, and then we put the uterine curate. Okay, the sharp end and the blunt end is used so that the things can be curated out, or the elemental tissue can be curated out. And it can also be used in dilatation and curettage operation 1 minute following the evacuation of the hydatidiform mode. In hydatidiform mode, we use the blunt end. Okay, so this is the blunt end and this is the sharp end. Okay, and these are the serrations we used to hold so that we have a better grip. Okay, then stop. Then coming to the next part, see, this is the Doyne's retractor. Okay, Doyne's. What is used? See, this one is the blade and it is slightly curved so that we get a better exposure of the things present in the cavity. Okay, pelvic cavity. So, or abdominal cavity. So, what is the used? See, we hold this like, and we can introduce the finger here, index finger, and so that we have a better grip of the instrument. And we just, if this is the bladder, okay, then we use to retract the bladder from the cavity so that we have a better exposure of the things. Okay, then so this is the Doyne's retractor. Okay, then coming to the next one, this is the Babcock's forceps. Okay, what is the used? See, Babcock's forceps. See, this one also we have the parts. See, what is the use of the Babcock's? See, this one is the finger rings we used to hold like this. Also, we can just hold it by the middle finger or the ring finger. Okay, and then here index finger is used for the support, and the Babcock's, it is used. It is slightly curved and it is fenestrated so that we can. But the difference between the Oban forceps and the Babcock's is that it has a catch. Okay, so this is used to hold the soft structure like appendix and the fallopian tube during ectopic. Okay, so this is the Babcock's forceps. Then this is the tissue holding forceps. This is the blunt tissue holding forceps. Okay, so this has a fenestration or serration so that for better grip. So what is the use? We can use for hemostasis purposes, and also we can use to hold the soft structure during episiotomy as well as during the stitch of the skin. And this is the see, this one is without tooth and this is the tooth forceps. Okay, this is the blunt plain forceps and this is the tooth forceps. Okay, then this is the BP handle. Okay, so blade is introduced and then it is used for the incision. Okay, this is the BP handle. Here also serrations are present for the grip, and here a fenestration is there so that the blade can be introduced here. Okay, so this is the BP handle. This is the, what is this? This is the needle holder. Okay, so needle holder, what is the difference between needle holder and, see, this one is the artery forceps. So what is the difference? See, this is the small curved artery forceps. So this has a curve, this has no curve. Okay, so, and here the fenestrations are present, but here a fenestration is present. Just look closer. Fenestration is present along with a dip inside. Okay, so that the grip is better to hold the needle. So this is a needle holder. Okay, used for suturing. Then this is the small curved artery forceps. It is also used for hemostasis and it is used to hold the small structures during cesarean section. Okay, then this is the fine scissors. Okay, it is used for dissection of the bladder in previous cesarean section. Okay, dissection of the bowel adherent bowel which is attached to the posterior wall of the uterus or lateral wall of the uterus. Okay, the serosal layer or the small fine structures can be cut through the fine scissors. Okay, then this is the Cocker's forceps. See, what is the difference between the Cocker's forceps? Cocker's forceps. See, Cocker's forceps. It has a tooth. Okay, so it is used for. So what is the difference between the artery and the Cocker's forceps? See, Cocker's forceps. See, it has also a lock. It has also a finger ring. It has also shaft. But the difference is it has a tooth. So this is used for the rupture of the membranes, during artificial rupture of the membranes. Okay, so it is used. And also we can use this in hysterectomy for the clamping of the uterosacral ligaments. Okay, so this is the Cocker's forceps. Okay, it is also a lock. See, this one is the tooth present here and has a gap so that the tooth can be accommodated here. Okay, so this is the Cocker's forceps. Then this is the valsalum. Okay, see, this one is it has a broad, okay, it has a broad end, and also tooth are present, multiple tooths or serrations are present, so that we can hold the anterior lip of the cervix, and a lock is present so that we can catch. This is also called as catch, so it is present so that we can lock, and the anterior lip or the tough structures can be held and retracted. Okay, so this is the valsalum. Then this one is the kidney tray. Okay, it is used when after delivery we can keep the placenta here. Okay, then we can use this for the painting. With betadine we can just pour the betadine here and we can paint. Also during PPH the amount of blood loss can be determined by using this. Okay. Then this is the kidney tray. This is the large kidney tray because it is kidney shaped. Okay, so this is the kidney tray. Then one type of retractor I have told you, that is the Doyne's retractor, and this one is the Diver's retractor. Okay, the use is same as that of the Doyne's retractor. Okay, this one is the Diver's, but it has a better exposure than the Doyne's retractor. Okay, because it accommodates less space than this. See, the space accommodated is less. So it has a better visualization of the pelvic structure. So I hope I have completed, and whatever is left I will be covering in the next part. Thank you for today. Okay, keep learning.